Yes, as I said, this is our rescheduled meeting from November 8th on observing men's health. And I note that this past Saturday was International Men's Health Day. Just a little, November is now known to a lot of people as Movember, when brave and selfless men around the world grow a mustache and women step up to support them, all to raise awareness and in some cases funds for men in support of men's health, and more specifically, in support of prostate cancer, testicular cancer, mental health, and suicide prevention. Last weekend, a golf tournament was held at Albany, and it was the Movember Cup. And some 30 plus men participated in that golf tournament, and part or most of the proceeds raised will be donated to the Cancer Society of the Bahamas. And after the tournament, they had an auction, which is very exciting. That auction actually raised $150,000, which was quite amazing, I thought. And so that will be a good, nice donation for the society. Quite amazing. So in keeping with that theme and presenting on men's health, our speaker tonight, Dr. Francis Williams, is a family medicine consultant and associate lecturer at the University of the West Indies School of Clinical Medicine and Research. He completed his undergraduate medical training at UWI Mona in 1998. He holds the distinction of being the first graduate to complete the DM degree in medicine through the Bahamas campus in 2007. He's employed by the Public Hospital Authority and privately at St. Jude's Medical Center. Dr. Williams has served in numerous positions and capacities, some of which include the president of the Hospital Doctors Association, chairman of the Bahamas Cancer Society, director of continuing medical education, consultant in charge of Ministry of Health's male health clinics, and acting deputy medical chief of staff. He is presently the chief of services of the Family Medicine Department. He's a member of the Medical Association of the Bahamas, American Academy of Family Practice, the Primary Care Association of the Bahamas, and the Caribbean College of Family Physicians. So as we said, he's a past chairman of the Cancer Society, so no stranger to us. And so with that, I will turn it over to you.
And thank you for having me, and thank you for those kind words. Okay, so as you said, Movember really is something that has come up within the last 20 years. In 2004, there were a group of men in Australia who really thought that there was not enough attention being given to men's health issues. And so they decided to shine a spotlight on the conditions, as you mentioned, and they decided to grow their mustaches. So you would see a play on words in the month of November. Since that time, many chapters have opened up around the world. And so that is what we're going to do tonight, is to bring some awareness to some male health issues. Now, I am not going to really spend any time on testicular cancer or mental health illness. You will see what I will discuss, but in the discussion component of the meeting, I would be happy to entertain any questions on any topics that you would have. So females continue to outlive men. And I think that if we were to look at the records, that from the beginning of life expectancy, the time that it started to be recorded, that women outlive men. And there are a number of reasons why that is the case. Men may have risky behavior, as well as some other factors that I will highlight soon. The 10 leading causes of death in men in the Bahamas are as follows: assault, and so we have a violent population, I think, as we all know. Ischemic heart disease, hypertensive disease, cerebrovascular diseases or strokes, HIV diseases, diabetes, prostate cancer, traffic accidents. Again, on the news, we last night, we tied the number of traffic deaths as last year, septicemia or infections, and heart failure. So these are the 10 leading causes of death. And so some of these conditions are relevant to both men as well as females.
What you saying?
And so I'm going to go through.
Who's in my room?
Now, men are much more likely to avoid seeing physicians unless absolutely necessary. Men just don't like going to see doctors. Men seek healthcare less often and usually at more advanced stages of disease progression. So usually when they come to a physician, it's quite often late. And we all know that disease prevention, wellness, and health promotion can add quality years to a person's life, whether it be a male or a female. So we should ideally look at screening to help to assist with men. And so if men were to screen, they should come once a year. Their height should be done at that first visit, and a weight should be done at every visit thereafter. We're assuming that after the age of 21, they're going to stop growing. Blood pressure should be done at least once per year. Diabetic screens in our population, I would recommend start at age 30, or if they're obese, may even start earlier. Cholesterol or lipid screen should start at age 30. And then PSAs, plus or minus digital rectal examinations, should begin at the age of 40, and colon cancer screening starting at the age of 45 in both men and women. And so I am going to spend a little time on hypertension, diabetes, ischemic disease, and then some time on prostate cancer and on any other cancers that you may wish to discuss. So hypertension is also called high blood pressure. It affects about 25% of males, and it's called the silent killer. What it means is that there is high pressure or tension in the arteries or in those blood vessels. And if that top number, there are two numbers when we talk about pressure, if that top number or the systolic pressure is consistently on 2 or 3 occasions greater than 140, and if that bottom number is higher than 90, then we can define that person as having high blood pressure. The exact causes are not known, but there are certain things that are associated with high blood pressure. And they include smoking, being overweight or obese, eating salt or fat regularly, drinking excessively, stress or physical inactivity, high cholesterol, being Black, or having a family history of hypertension. Usually there are no symptoms, hence the term the silent killer. And so that may not always be the best thing, because persons can go on for years without having any symptoms, may be present and remain unnoticed for many years or even decades. And when they show up and are diagnosed, it may really be too late. Some persons with uncomplicated high blood pressure may experience headaches, dizziness, shortness of breath, and blurred vision. Over a period of time, high blood pressure can damage blood vessels all over the body and may lead to abnormal widening of blood vessels, in some cases, aneurysms. Some blood vessels may become narrower from cholesterol and thickening of muscles of the arteries. Narrow blood vessels may cause decreased blood flow, and that can happen in any blood vessel in any part of the body. In the brain, that may lead to strokes in the kidneys, may lead to increased stress on our kidneys. In the heart, it can lead to coronary artery disease, painful chest, shortness of breath, heart attacks, can affect the eyes, and it can affect other parts of the body. Most of these risks are more severe if there are other medical conditions or comorbidities, we would say, such as diabetes, obesity, high cholesterol, or previous strokes or heart attacks. And so this would be a picture of somebody in accident emergency having suffered a heart attack. Hypertension has no cure, but it can be controlled. And it requires a lifelong commitment to changing some eating and lifestyle habits. Medications may also be required, and regular follow-up is essential. Diabetes. Last week, if you were watching the news, the PAHO representative for the Bahamas was on, and they talked about us having a 12% prevalence of Bahamians with diabetes in our country, and about another 7% who are pre-diabetic. And so, you know, some may debate whether we should screen for diabetes every year, but given the high levels of diabetes in our population, I think that it's reasonable, certainly after the age of 30. And we see cases like this, unfortunately, far too often. Diabetes really means that the blood glucose or sugar in the blood is too high. The blood always has some glucose in it. So if we eat, whether you're diabetic or not, there's going to be some level of glucose in the blood. And blood glucose is important for us to have energy. Glucose comes from food, and it is also made by the liver and from muscles. So diabetes is when it is difficult to use the glucose in the blood. And it can happen in two ways. Either the pancreas does not make sufficient insulin, or there's enough insulin, but the receptors that help use that insulin are not enough. And so we will define a person to have diabetes if their fasting glucose is greater than 126 milligrams per deciliter, or we can do a challenge where they will drink a cup of sugary fluids, or sometimes we will just do a blood test, and if that blood test is greater than 200 milligrams per deciliter, 2 hours after that sweet drink, then we can also diagnose them with diabetes. Or if a person has a test called an HbA1c, which is greater than or equal to 6.5, we can use any of these three approaches. The HbA1c is also used to monitor a person's sugar, and this is a test that uses red blood cells, which have a lifespan of about 90 days, which allows us to monitor these tests every 3 months and gives us some good reliability. There are some cases that we may not want to use the HbA1c if a person is anemic for various reasons. So again, some persons with diabetes have absolutely no symptoms, and they can go on for years without any symptoms. But some of the symptoms that are more common might include excessive thirst, frequent urination, being hungry all the time and losing weight, being tired, changes in the vision where the vision can become blurred. Sometimes they may have cuts that take long to heal or get infected easily, itching, and sometimes, unfortunately, these patients will present in coma and die. So again, once we have diagnosed you, there really is no cure, but that doesn't mean that everybody needs to go on medication. You know, we recommend people to live good lives, that is exercising and diet. And some persons can be controlled on diet and exercise alone. Weight loss for obese patients has shown to have great impact. And so some persons who may lose 10% of their body mass and obese and diabetic, that may be all that they need to do. So treatment will manage from patient to patient. And of course, some patients will have to go on various types of medications. Now, we had said, and so diabetes, we had said in one of the earlier slides, is the 6th most common cause of death in men. Hypertension, hypertensive diseases is the 3rd most common cause of death in men. Now we're looking at some blood vessels. And if we look at this blood vessel here, this blood vessel is very, very clean. And so the blood flow through that blood vessel is optimal. As our diet sometimes is not so good, cholesterol starts to build up, we can have these blood vessels becoming narrower, and they may create plaques, and plaques may break off, and plaques may ultimately lodge in some of these blood vessels that supply the heart and cause heart attack. Now, I think some persons are old enough, and when President Clinton was president, he had what we call coronary artery disease, started to have chest pain, underwent a quadruple bypass, and that was because his blood vessels became narrower. Over a period of time, he started to have chest pain and some shortness of breath, even though he exercised regularly. I think most persons would remember that one of his favorite foods was hamburgers at that time. And so we have to be careful with the diet. Here again, for persons who have strokes, some persons, when we look at the blood vessels along the neck, the blood vessels may become narrower, and cholesterol plaques can be deposited in those blood vessels. And again, plaques can break off and lodge in certain blood vessels in the brain, which may lead to strokes. Some signs of strokes, we may see persons that are not able to speak properly. You may notice that the shape of the face may change. So here you have loss of the creases in the forehead. You may have some deviation of the mouth, and you may have some impediment of speech. They may not be able to walk properly. Loss of power and tone may be some of the things that they have. And so now I'm going to talk a little bit about cancer. So I think we probably talk quite a bit and quite frequently of various cancers at the Cancer Society meetings. And so I think most of us know that cancer occurs when the abnormal cells divide without control and are able to invade other tissues in the body. So technically, cancer can affect any organ or any tissue in the body. And some persons may not know that. You can have cancer in the heart, for example. It may be very rare, but cancer can really occur anywhere in the body. Early detection of localized lesion offers easier resection and treatment, and often better outcomes if we can find these cancers earlier. So, prostate cancer, which is definitely one of the themes that is included in Movember, is pretty common, is actually the #1 killer as it relates to cancers in Bahamian men. So the prostate is a small gland in men, and it is part of our reproductive system. It's about the shape and size of a walnut. And so anybody who deals with their fruitcakes or cracking those nuts at Christmas time will know the size of a walnut. It rests below the bladder and in front of the rectum. It surrounds part of the urethra being like the pee hole that carries urine from the bladder to the outside, and it helps to make semen. So when we look at this picture, if we can see this picture, we see bladder. This is the container that holds our urine. And we have the prostate directly under the bladder. And this tube comes from the bladder. It comes through the prostate and it goes to the outside of the body. Okay. Here we have the rectum. And so the thinking in terms of the digital rectal exam is that the physician would put his digit or finger, and if there is something wrong with the prostate, at least in the posterior or back portion of the prostate, the physician may be able to feel that. Now, prostate digital rectal exam seems to be going out of vogue a bit. And so you have less physicians that are doing digital rectal exams, but you still have quite a few physicians who do it. So again, prostate cancer is the most common cancer in Bahamian men. 1 in 6 Bahamian men will have prostate cancer. 2 to 3 men in the Bahamas die every week from prostate cancer. The causes of prostate cancer are not fully understood, but we do know that men with strong family histories of prostate cancer are at greater risk of developing the disease. Blacks are more likely to get prostate cancer and to get it at an early age. And it is associated with the BRCA breast cancer gene as well. Diet also has an impact. So high-fat diet, dairy milk, cow's milk may be associated with prostate cancer. And so here again, we have a picture. This picture here suggests where there is just enlargement of the prostate. And so quite often, you may have a male who may have increased urination. You may see him stepping out of a room all the time, rushing to the bathroom. And so that may be as a result of an enlarged prostate. Quite often, and so we see here the bladder, we see that this enlargement occurs around the urethra, which is the tube that takes the urine to the outside. Now here, here we see what is a pictorial representation of prostate cancer. You will see that it really does not, at this point in time, does not affect this urethra. And so men can go on for years without any urinary symptoms and have prostate cancer. And so it's important for men to know that. It's important for women, partners to know that as well, to send their men to get checked up because there may be no symptoms at all. I guess since we have this picture, we can then see why men who have enlarged prostate or what we call BPH have certain symptoms. Because if this tract or tube is being squeezed, then a man may have issues getting the urine out. He may have hesitation, or he may have poor urinary stream. He may have to start and stop. Quite often, if the bladder is full, he may have to go to the bathroom several times. So during the day, he may have frequency, or at night, he may wake up several times to try to empty the bladder. And quite often, there may be urgency as well may have to rush to get to the bathroom or may end up peeing up himself as well. And so, as I said, when we return back to prostate cancer, there may absolutely be no symptoms for much of the time at all, or can have symptoms that are similar to that of enlarged prostate, depending on where the prostate cancer is occurring. And here we have a picture of the digital rectal exam where the finger touches and may feel abnormalities, may feel abnormal groove, may feel swellings in the prostate that are irregular. Here we have a person doing their blood tests that for the PSA. And there are other tests as well, DNA tests that are also being done, which are more expensive, but may be more reliable. And so when we look at the PSA, we keep the number 4 in our minds. If it's 4, depending on the age, we may get concerned. So certainly before the age of 60, greater than 4, we don't take that lightly, and we may want to refer that patient to get further tests or biopsy. So I was given a certain time, and I think I'm pretty close to that time. So in general, though, I think that it's important for all of us to be educated. Certainly men need to be educated. For men who smoke, certainly increase the risk of hypertension, coronary artery disease, which are causes of death. We need to watch our weight. We need to eat right. We need to control our blood pressure. We need to exercise regularly, and we need to get frequent checkups. And so that brings me to the end.
Dr. Williams, thank you so much for your presentation and also for agreeing to reschedule after we weren't able to have the meeting come off the last time. So we appreciate your willingness to come and share your information with us tonight, which has been very helpful, I'm sure, and hopefully it'll go a long way towards getting men to take, I guess, their health a lot more seriously